Hello, Dr. Jaideep Khare.
Hi.
Welcome to the meta-kinology of semaglutide.
Thank you.
So, right now there is a significant buzz around semaglutide as it recently become off patent, and there is a significant doubt exists in physician's mind that whether he want to prescribe in particular patient or not, because obesity is one indication. But when it comes to the Indian patient, the criteria for diagnosis of BMI is different. When it comes to the diabetes, the comorbidity prevalence is very vague, the data is limited. So, I just want to understand what are the ideal candidate for semaglutide 1 milligram as well as 2.4 milligram.
Very nice question here. As we all know that semaglutide is one of the most favorable molecule which has shown so many pleiotropic effects beyond just good glycemic control and controlling the weight. So, when we are looking at semaglutide, I will say that it should not be looked as just like an anti-obesity molecule. It is having very good glycemic control. So, in Indian patients especially if we are talking about the HbA1c reduction is very good, and as you are talking about, we are having limited data regarding the comorbid conditions like cardiovascular diseases, renal diseases, the MASH, the liver diseases, and other conditions like the pre-diabetic patients or just metabolically unhealthy obese. BMI may be on the lower side, but they are having inflammatory processes which leads to several complications. So, just beyond obesity, it can be used in each and every patient. Those who are having cardiovascular conditions like atherosclerotic cardiovascular diseases or chronic renal failure or the MASH, and the recent Essence trial has approved it for the MASH also. And if I will talk about, then off label I am using it in PCOS patients also, and the studies are going on, and several dermatologists are using it as an anti-aging molecule also. So, but I will not recommend that it has to be used, but it has to be individualized according to your clinical practice, according to your knowledge. But yes, just not an anti-obesity molecule. Now it is showing that it has multiple benefits. Even the neurologists have confirmed that it is improving the dementia, and it can be used in even in Alzheimer's disease. Thank you.
Yeah, thank you, Dr. Khare. So, as you rightly pointed out that the comorbid patient of type 2 diabetes or obesity, they are the ideal candidate for the semaglutide therapy. So, in that context, I just want to understand that how important is to screen the patient of diabetes from day one for the comorbidity, because right now majority of patients are missed during the first visit, because maybe because the cost concern or whatever the reason, they are not screened properly for all the comorbidities.
Very true. So, what our various studies suggest, if the patient is diagnosed with type 2 diabetes, there are 50% chances that there might be some comorbid condition at the time of diagnosis itself. So, each and every patient should be diagnosed, especially for nephropathy, cardiovascular diseases, and the fatty liver at the time of diagnosis of type 2 diabetes. If it is type 1 diabetes, it is not actually indicated right now, but may be used off label in near future. So, in type 2 diabetes, whenever it is diagnosed, it should be the patient should be screened, and GLP-1 analogs, if not contraindicated, should be used.
Thank you, Dr. Khare, for your practical insight.
Thank you.
Thank you.
Thank you.